Now today, we're joined by Dr. Talimor Wycliffe Da. I hope I pronounced that one correctly.
Right.
Okay, he's a renowned clinician, an expert in obstetrics and gynecology. Now, Dr. Da has worked extensively in Nigeria, managing complex clinical situations and promoting healthcare development. Now, we'll be looking at the causes, symptoms, and solutions for breast and cervical cancers, particularly in the Nigerian context. What are breast and cervical cancers and how do they occur?
Right. We all know what the breast is.
Yes,
the breast
most
is a mammary gland.
Yeah.
In humans, there are two,
Mm-hmm.
and males and females, they have them.
Okay.
If a woman delivers, that is where she suckles the child from.
Mm-hmm.
And because that function is not needed in the male, the organ doesn't develop much, so
Okay.
it is not big and protruding kind of.
Yeah.
The cervix is an entirely a female organ. It is the common name is to say it is the neck of the womb. The womb is the uterus, is the place that the baby stays to grow, and if there is no baby, it's the place where menstruum comes through the womb.
Okay.
And follows through the cervix to the outside. So the cervix is kind of the neck of the womb. Those are the two different organs. When cancer develops in this, they are called breast or cervical cancer.
Okay. Okay, so that's it. All right, well, breast and cervical, cervical, you call it.
Yeah.
Cervical, okay, correction taken. Breast and cervical cancer. They're quite significant health, concerns, and they affect women globally, right? Particularly if you come down to Africa and Nigeria, according to the World Health Organization, that is the WHO, cervical cancer is the fourth most common cancer among women worldwide, with approximately 570,000 newer cases reported annually. In Nigeria, breast cancer is the most common cancer among women, with a high mortality rate due to late detection and limited access to health care. Do you agree with this? Totally.
Yeah, those are right.
All right.
statistics.
Right. But then, what are the possible causes of breast and cervical cancers, though?
For maybe we divide them.
Okay.
Breast and then cervical.
Okay. Awesome.
They, they only share one or two things that you could say they are possible causes. But when we talk about the breast, causes, you can hardly find something that you can relate directly to the breast. That this, you eat this, you get this. You drink this, you did this. You are this, you get this. Even those that we say they have genetic predisposition, they don't always have to develop it. And even those that we say they don't have the risk factors, they don't tend to develop it. So rather than say causes will have a cause effect.
An effect, yes, cause effect.
But risk factors are things that places you in the vicinity of acquiring such thing.
Yeah.
So for breast cancer, we should talk about the risk factors.
Okay, so
Rather than
the causes.
the causes. And the risk factors, they will include the fact that you are female, because like I said, males have the breast also.
Yeah.
But they develop cancer also, but not as common as the females who develop it. And also any history. If you have a family history that your mother, your sister, your daughter developed breast cancer, you stand a higher risk than somebody who does not have that family history.
Okay, I get that.
If you yourself, talking still about history, if you yourself had a breast cancer some years ago treated, you stand a higher risk of the other one having a cancer. Or if you yourself also has a history of some conditions that we call pre is before,
Okay.
precancerous diseases, some lesions that are not full-blown cancer, but when we see them, we know that if we leave them for years, they're going to develop to cancer. If you have a history of that, you will also stand a risk, more risks than the general population.
So sorry to cut you. I've heard about lumps. Is that also a part of risk factor?
Yes.
Oh,
if you are
okay.
developing lumps.
Lumps, okay.
Because some of these lumps are part of the precancerous things.
Right.
Some are outright cancers themselves.
Oh.
We have to check to know what exactly is. So those group of things I've spoken about are history. But some have, connected to this history is the likelihood that it is genetics, meaning that some of the genes that your relations had, you had it too. So one or two genes may be implicated that if you have it, you stand a higher risk of breast cancer than other people. The other things are developmental.
Yeah.
If you happen to, normal females, we see their period at some point that we call menarche, you're beginning to see period. And at some point we say menopause, the period is stopping.
Okay. Menarche, when you began,
yeah.
menopause is when it stops. Okay.
If you start that menarche quite too early, like maybe earlier than 11, 12 years,
Yes.
you are likely to stand a higher risk. And that is unfortunate because today, a lot of our girls are beginning that menarche at 8.5, 9 years, 10 years, for reasons that they are exposed to things that sexuality things on
Really?
television and so on.
Really?
So if you start earlier than 12, you stand a greater risk. And if you end your reproductive years, the menopause comes like 55 or later, you also stand a higher risk. So that's it. The other thing is, this how they got about this risk is when they do large studies, they discover that this group of people stand this risk. If you do not give birth early, if you give birth late, like nowadays is the case, a lot of people give birth after 30.
Yeah.